when patients first meet with me, whether they're bariatric or medical weight loss, I do a nutrition assessment, which basically is I'm interviewing them. I jump right into what they eat in a typical day, find out their weight history, of course, medications they're taking, who they live with, how often they're cooking, do they eat fast foods. And then at the end of the session, I do the same for bariatrics, but it's a little different with medical weight loss. I look at their usual dietary intake and I make a few tweaks or little changes. And then I present them with my plan. Sometimes I'll individual handwrite or even on a legal pad a menu for them to follow, or sometimes I'll type up some menus and some recipes and put it together. And I always say this, there is no one size fits all diet. We're all individuals. So I don't, I might have a handout I can give to somebody, but I do try to individualize everything because everybody's different. I like myself, this is just me, I like working with meal replacement shakes for myself to manage my weight. It works well for me. Other folks don't. Some people, this is medical weight loss difference to get back to that. Some people like to eat 5 or 6 small meals a day instead of 3 meals a day. We can incorporate that into that. We can incorporate meal replacement shakes. Some folks don't like breakfast foods, so we can figure out, hey, we can eat a turkey sandwich with some fruit in the morning. Just different things. I really individualize my education each time a person comes in. And when they come in for medical weight loss on their second visit, we'll reassess. How are things going? Okay, we're going to base it if they've lost some weight. But more importantly, I always ask them, well, what are some of the things that you're doing since we talked the first time? And that's the basis for building on behavior modification, lifestyle changes.